Hi, it's me, Dr. KT, and welcome to ODDDUCKSCIENCE. Today, I want to talk about systemic oppression and how it has had a lasting impact on Black people, brown people, and poor people, and the way that we show up when it comes to the medical field, how we trust those individuals that are placed before us. And there are so many experiments that we can call on that have created this harm, that has created this distrust. And I'm going to talk about two of them today. One I'm pretty sure that you're familiar with. So let's jump into it. The first one is the Tuskegee study. The Tuskegee study was based on looking at a sexually transmitted infection called syphilis that was caused by a bacterium. Now, the United States Public Health Services went down to a rural part of Alabama and enrolled 600 men into this study. They told these men that they were going to treat them for their bad blood. Bad blood is an ailment that is used to describe fatigue or to simply describe anemia or a variety of different common ailments of that time. And they also promised to get medical treatment. They would get to see a medical doctor. They would get meals. They would get transportation, and then they would get burial insurance. Now, these things seem very enticing because this is in the backdrop of the Great Depression. So things are extremely tight. Now, of these 600 men, 400 of them had already been diagnosed with syphilis. 200 of them did not. So we would say they are the control group. Now, again, this demographic are African American men who are sharecroppers. Hold that. Now, this is where it gets egregious. The United States Public Health Services withheld a lot of information from these men. They flat out lied to them. They told them they were going to treat them for bad blood, but that was not what they were going to do at all. What they wanted to see, the real purpose of the Tuskegee experiment, was to see the long-term effects of syphilis on the body, and specifically in Black men. So that's one thing. The second thing, when they told them they would get treated for bad blood, what they gave them was placebos. And placebos are can be a pill that has no medicinal value. So you think about a child coming to you to say that their ear hurts or stomach hurts, and you give them a Tic Tac or you give them a Skittle. No medicinal value. So they gave these men things like aspirin. They gave them some types of supplements like magnesium, nothing that was going to treat syphilis. They took blood from these men quite often, gave them x-rays, and they also made them endure very painful spinal taps. And all along the way, they're collecting information to see how this disease continuously progresses. About 1942, which was about 10 years in the study, because again, the study is from 1932 to 1972. So around 1942, there is a recommended treatment for syphilis, which is penicillin. And penicillin is recognized as an antibiotic that would cure the men. The Public Health Service researchers persuaded the doctors not to give the men the treatment. So there was treatment to cure these men, and they chose not to because they said it would mess up their experiment and they would not be able to see the long-term effects. Because of that, what we know is 28 of the participants died from syphilis. 100 of them died from complications. Think about those painful spinal taps. Think about neurological damage that was occurring as syphilis began to ravage the body. The third thing is 40 of their wives contracted syphilis from their husbands. And then 19 children contracted syphilis because they got it from the birth canal of mom. All right, I know we're breathing. Hold that information because now I want to travel to another country. In Guatemala from 1946 to 1948, some U.S. doctors and Guatemalan doctors intentionally infected 1,300 people in Guatemala with 3 STIs, gonorrhea, syphilis, and cankerous. Now let's talk about the population, which is very interesting. They chose sex workers, they chose prisoners, they chose psychiatric patients that were housed in a hospital, they chose orphans, and they chose children. Again, another demographic that could not speak up for themselves. Now, the purpose of this one was to see if they could use an adjunct therapy or a supplemental therapy along with penicillin and kind of see what would happen there. Yes, another egregious, another heinous act that was done by medical professions. Okay. Now, the thing that gives me hope is whenever I'm reading about one of these things, I find that there's always one person that is willing to speak truth to power and to bring darkness into light. And that was Peter Buxton. What he did, once he found out that they were withholding treatment, he ran to the newspapers and he started leaking information out. Now, one key thing that I want to tie between Guatemala and the Tuskegee experiment is that one of the researchers that was running the Guatemalan study left that study and went to the Tuskegee study to finish there. So these are very uniquely linked. The media did what they were supposed to do and got the information out. And so this caused the Tuskegee experiment to stop. There was a lawsuit that came because of the Tuskegee experiment, and it was a $10 million settlement outside of court. I'm going to breathe again here. Because when that actually broke down, what it meant was the survivors received $37,000. Their heirs received $15,000. They received burial insurance and free medical care for the rest of their lives. It doesn't seem like much compensation for the amount of pain that these men endured and their families. Some of them lost their lives. Some of them died of debilitating diseases. They went blind. They lost their minds because the neurological impact that syphilis has on the brain. Yes. Now, with Guatemala, the interesting thing is we didn't know about this until 2005. A researcher was going to look at how horrible the ethics were in the Tuskegee experiment, and she stumbled upon the papers and found this. Now, the survivors of the Guatemalan experiment have not been compensated. They've had several litigations, but they've been dismissed. Now, I know you're like, okay, Dr. Katie, that's a lot. I will say that something great did happen out of all of this turmoil and just fallacious acts against humankind. We now have something called informed consent. And what informed consent is, you give that to anyone who wants to participate in a clinical trial, and it tells them the risk, it tells them the benefits and the purpose of the study so that they can make an informed decision whether they want to be a part of it or not. Now, let's take the 3 Ds with this. First D, what do we know? We know that syphilis is an STI. We also know that penicillin is an antibiotic that can cure the STI, syphilis, which is a bacteria. What we know because of the Tuskegee men, we know the long-term effects of having syphilis. So we know the different stages. The second D, diversify. How am I supposed to deal with this? How does this affect my community? We're still seeing effects today. When it comes to clinical trials, Black and brown people are usually underrepresented because we don't want to be in these, because we've seen the harm that has occurred from generations before and what was done. So there's a mistrust level there. So when it comes to new drugs about asthma or breast cancer or lupus, oftentimes we're not there to be a represented population to be taken in consideration to see if the drug doses needs to be altered. So that is how it's affecting. The last D, dazzle. How can I put my spin on it? As always, we want to make sure when conversations are coming up about clinical trials that we talk to people in our community, and we even consider ourselves to say, you know what, this can be a benefit for everyone around me. Yes, we've heard about the Tuskegee experiment and so many more, but now we have the opportunity to read all of the information in front of us and make an informed decision. I hope you learned something today. As always, science is accessible for everyone. Until next time, have a glorious day.